Hi, welcome. Let's talk about bland diet and low protein diet. A bland diet is designed to be gentle on the GI tract. It includes soft, low fiber, and non spicy foods. Avoid irritants to the GI, such as foods high in fiber, the likes of salads. Avoid acidic foods like caffeine, chocolate, citrus fruits, tomatoes. Also, avoid alcohol and fried foods. Bland diet is often prescribed for patients with ulcers, gastritis, GI reflux, or post-op patients. The purpose for bland diet is that it reduces gastric irritation and allow healing of the GI tract. Bland diet, even though gentle on the stomach, the downside is that it's not very nutritious. Some of the nursing responsibilities include teaching the patient about the type of diet they are on, what they're allowed to take, and what they're not allowed to take. Monitor tolerance for this diet. We expect to see less pain, less GI reflux, nutritional adequacy. Like I said, bland diet may lack fiber and variety, so the patient may need some supplements. You can advance the diet to regular diet once the GI tract has healed. So, which meal is appropriate for patient on a bland diet? Correct answer should be examples: baked foods like chicken breast because it's not fatty or spicy, white rice because it's low on fiber. So, let's move on to protein restricted diet or low protein diet. This is a diet that limits protein intake to reduce the workload on the kidneys or liver. It's indicated for patients with chronic kidney disease, end-stage renal disease, and liver failure. We restrict protein intake in patients with kidney failure so as to minimize uremia. Uremia is a buildup of uric acid, which is a byproduct of protein breakdown, and the only way for the body to get rid of it is through the kidneys. Low protein diet is always recommended for patients with liver failures or cirrhosis. The liver helps the body by breaking down ammonia, which is very toxic to the brain. Ammonia is a byproduct of urea breakdown, and urea is a byproduct of protein metabolism. So you get how the circle goes around. So, liver failure means buildup of ammonia in the system and can cause hepatic encephalopathy, where the patient has a decline in mental status. For patients with, also, we recommend low protein diet for patients with metabolic disorders like phenylketonuria, PKU. They cannot take protein at all. These patients, we don't even restrict, they cannot take protein. The reason being is that phenylketonuria or PKU is a rare genetic disorder where the body cannot properly break down the amino acid phenylalanine, causing it to build up to toxic levels, damaging the brain and the nervous system. This can lead to intellectual disability, seizures, and behavioral issues. So, for patients with liver and or kidney failure, we limit or restrict protein intake. But for PKU patients, no protein intake whatsoever. They cannot break down the phenylalanine amino acid. So, restrict intake of high protein foods like meats, poultry, fish, eggs, legumes, nuts. Some other rich sources of proteins are dairy products like milk, cheese, and yogurt. What are the nursing responsibilities for protein patients on protein restricted diet? Patient teaching: always inform your patient why they're on this diet and what benefits they expect to see. Monitor labs, kidney, and the liver just to make sure that they're not being damaged. Maybe the patient is not compliant. So if the patient is not compliant, you will see damage in the kidney by looking at the kidney labs. That will be elevated BUN, creatinine. And for the liver, you might see AST, ALT, bilirubin, ammonia elevated. Ensure adequate calories from carbs and fats to prevent muscle wasting. Collaborate with dietitian to individualize the protein intake to the level or the stage of kidney or liver disease. Always monitor for complications. Low protein intake can cause malnutrition, weak muscle, poor wound healing. Thank you guys, and I'll see you on the next one.